Thank you so much. Thanks for having me, and I'm glad to see such a diverse and large group. So it's great to be here. Have been and continue to be a practicing pediatrician. I was doing primary care for about 20 years at Unity Healthcare, which is based in Washington, D.C. Through a federally qualified health center. And most recently, I've actually been doing some shifts through the emergency department at a children's hospital just over the border. So I'm actually in Canada. I've been here for a couple of years and we'll be here for maybe another 2 more. And I've been really enjoying that as well. I have a background in public health, and of course, as you'll find out in just a second, a strong interest in nature and human health, planetary health, and I'm excited to share with you a little bit about my work, and I look forward to hearing your questions. I guess I did not say that. I probably should say as well, I'm a certified nature and forest therapy guide. For those of you who are not familiar with that, there is an Association of Nature and Forest Therapy. And I went through an amazing intensive course and then a 6-month practicum after that back in 2019 and 2020 to become certified. So I do also a little bit of that when I have time in terms of guiding and doing walks. But mostly at this point, I'm just kind of doing it for myself and maintaining my own health with the nature therapy. So next slide. No disclosures to make, except I think what Shannon already pointed out, which is I'm the founder and medical director of PRA, which is Parker X America. It's a non-profit organization that was founded back in 2017. Next slide. So pretty straightforward learning objectives. I'd like to kind of summarize a little bit about where we are in terms of our chronic health on the epidemic that we continue to be in. I'd like to jump then pretty quickly and show some of the evidence that supports spending time in nature and what does that mean for human health. And then really sort of finish it off with kind of going a little bit deeper into nature prescriptions, park prescriptions, as it might relate to recreational therapy. So, and introduce PRA. Next slide. So any show of hands, I guess I'm not sure I can see all the hands, but nature pyramid, you may have seen this before. My work is really centered at the bottom of this pyramid, so I'm really focusing mostly on nature that is close by, it's accessible, it's frequent. And this pyramid suggests that less intense. And I would suggest that it's not always that case, in that we can have very intense and therapeutic experiences very close to where we live, work, play, sleep, etc. We don't necessarily have to take these trips to faraway places once a year or once in a lifetime. They are important, but it's not the work that I do. So I'm really focused at the bottom of this nature period. Next slide. Well, this is what a lot of us see ourselves doing all day, or if we're not doing this, we have many clients and patients who are quite sedentary, lots of electronic time, device time, sometimes not enough time to eat. And when we do eat, it's often fast food, lots of stress, and then coming to us often asking for pills, medications, and let's not forget referrals to many of you. All right, next slide. We all know this very well. I saw the show of hands as who does what. We've got nurse practitioners, PAs, psychologists, licensed therapists, social workers, etc. So I think this slide is sort of just a quickie just to remind us that we're not anywhere near where we need to be in terms of focusing and dealing with this epidemic of chronic disease. Next slide. Next slide. So let's jump in a little bit to some of the evidence that's been building over really decades now. There are a number of studies out there, published studies, ranging from correlational studies, population studies, to now we're seeing more and more even meta-analyses and systematic reviews, and also the gold standard, these randomized controlled trials. So we're seeing a variety of different studies that are happening, not just in the US, but all over the world, And I cannot in 20 minutes present all of that data, but suffice to say that a lot of these studies are accessible to you. You can find them on PubMed. The Children in Nature Network does have a research place in there, and they do catalog a lot of wonderful studies, not just pertaining to children, but to adults as well. In fact, most of the literature is still very much focused on adults, as it is in almost all of the scientific literature. But there is some building evidence now with some studies that are looking specifically at kids too. So physical activity, we all know it's good. To move is a good thing. What people do not often recognize is that to move outdoors or to move in a more nature-rich place does add that additional benefit of the mental health piece of this. So just something to remember when we're talking about incorporating physical activity into recommendations that we make. Next slide. Stress is a big part of our patient lives. It's a big part of our lives as well. We know that gardening, we know that spending time outdoors, we know that spending time in forested areas. Some of the most interesting studies that were done many years ago in Japan, actually, that were looking at these 3-day, 2-night excursions into these forested areas. Part of it involved looking at the change in salivary cortisol as a stress hormone. So we do know that there is a significant drop. It's not the only change that we see, and you'll see later, and I think I have another slide about natural killer cells. But stress is an important aspect, stress recovery, of spending time in nature-rich areas. It's well documented in numerous studies. And there is also this restoration, tension restoration that occurs. And I'm not an expert in any one of these particular areas, but I've been so fascinated and curious as to what fellow researchers around the world are finding out. And I was just chatting with a colleague of mine yesterday, who's a psychologist, and we're writing a paper together and doing some research together as well, that this field is so rich because it pulls in together not just doctors and your psychologists and the people you would guess would be the ones doing a lot of this research, but we've got landscape architects who are doing this, people in the park and recreation world who are doing this kind of research. So it's really quite interesting in that it pulls in so many different angles, points of view. Next slide. Well, you saw the previous slide about hypertension. I'm only laughing because I just saw my doctor yesterday and we talked about my hypertension. Very, very common, and the silent killer, as we call it. And we do know that being outdoors does in fact have an interesting effect in lowering blood pressure. It also has been well documented to lower your heart rate, among other cardiovascular aspects, which I will not go into, but certainly well documented reduction in hypertension. Next slide. I only put sleep in here because probably those of all of us on this call are not always the best about getting good quality sleep. And we probably don't counsel as often as we perhaps should with our clients about the importance of sleep. And probably even less so relate it back to our time outdoors. And so there definitely is some data showing improved sleep, increased in hours and quality of sleep with people who have more access to these nature-rich areas, which are more likely to be in those areas and spend time in those areas. Next slide. I had diabetes up on that earlier slide as well. So, diabetes and hypertension do not go well together, as you know. Once again, I mean, we've got a tremendous epidemic of type 2 diabetes, and we know that living near greenness, as it's called in this particular study, does impart a protective factor against diabetes. Next slide. We've talked a lot about sort of physical aspects. We probably tend not to focus as much as we should on mental health and behavioral health and just overall wellness and well-being. I only put up here depression as one of many examples of types of mental illness that do show an improvement when we talk about time spent in these nature-rich areas. Next slide. I kind of alluded to very earlier, a little bit earlier on about these natural killer cells. Another fascinating bit of data that came out of Japan many years ago that still seems to capture people's attention. Natural killer cells, as we know, is a part of our immune system and thought to be a protective factor against cancer. And these phytoncides, or these organic compounds that are released by trees, not just pine and cedar, but those are the two that I think are most prominent in the areas where they did the studies, seem to have a positive effect on increasing the activity of natural killer cells and it lasting for several days, if not up to about a month. So this is all to say that, you know, spending time near trees is a good thing. Next slide. So that was my brief overview of the science. There's a lot more that I just don't have time to go into. I'm actually doing my own research now, which I may touch on if you care to at the end. But let's jump in a bit now to this idea of the nature prescription, otherwise known as the park prescription. And just a quick moment for clarification on that. Yes, I mean, I've definitely been involved in this for a while now. And when I first started, it was very much the park prescription, which fits nicely into the Healthy Parks, Healthy People National Park Service launch. And its concept really is well understood and well appreciated by most people. I choose to talk about nature prescriptions more these days, only because not everybody has access to a park. And speaking of it in broader terms like this really allows everyone to be able to sort of access this concept, and I hope actually implement it and turn it into a prescription. So there are some similarities, obviously, and I've really been still very much in favor of calling it a prescription. For a few reasons. I mean, number one is, RX or prescription is known by all providers. It's known by all patients. There's really no one in the world who doesn't know what a prescription is, or at least the basics of it. So it sort of, it sets a stage where we can kind of jump right in and have some understanding of what this is. It's a recommendation, a strong recommendation, right, in the form of prescription. The differences, though, quickly become that the nature prescription is not something that we as providers just write down and hand over to somebody, and it's something that we come up with. It's really a more of a collaborative process that takes 2 to 3 minutes for, I would say, the most expert prescribers that I know in my world. So it takes a little bit of time, but if you're the type of healthcare professional who takes that time anyway to counsel, it's not necessarily that much more time. Like if you're going to take time to talk about, to counsel about physical activity or mental health or diet, things of that nature anyway, so the behavioral changes, it's not necessarily a whole lot more conversation, but it's turning that conversation between you and your patient into something that actually generates a prescription. Next slide. So this is our homepage. If you care to visit, you can find it by just typing in natureprescribed.org. I would rather you go there than to the longer version, which is Park RX America, only because you might forget the America and it takes you somewhere else, which is a good place, but not my place. So natureprescribed.org is how you get to here. We have 3 portals, one for patients, one for providers, and one for everyone else. That's not meant to be necessarily funny, the everyone else, but it's the way we sort of captured, really the third group of people we think who might be accessing our website. But there's basically 3 portals to get in. Next slide. when you go to actually prescribe nature, the first thing that comes up is this sort of patient adherence. So it's a way to remind you, hey, did you do a previous prescription? And if you did, check it and see what happened. So every provider has an individualized account. We have about 1,700 providers now across the US. I was listening to all your different specialties, and every one of you is represented already or at least your specialty, is represented in our our community of prescribers now. We have a lot of mental health, behavioral health folks who've joined our community to use our platform. It is free to use. But getting back to this, every one of you has will have, if you join, an individualized account. And what that does is it gives you a constant running tally of every prescription you've ever written. Now, every prescription is unique, right? But it gives you an opportunity to go and see, when you're seeing your client, what happened the time before, and it helps to inform the next prescription. These prescriptions are not meant to be a one-off. They're meant to be something that's done at nearly every visit, where and when it's relevant. So if you're seeing somebody for hypertension or depression or anxiety or elevated A1C, on and on and on and on, because there's so many conditions which you would find relevant to write one, then it allows you the opportunity to go back there and see what happened last time. How many times did they log their visit? Were there clusters of logs of visits? So when did they actually fill their prescription? Next slide. So this is what it looks like. There's 4 components to it. There's a place, activity, frequency, and duration. We went through a pretty serious revamp about 1.5 years ago to try to make this even easier than it was. And one of the things that we did was insert those questions. These are questions for you, really, as a provider to kind of think about. They're also questions for your patient to think about. So patients can go onto our website, they can write their own prescription, self-prescribe, then bring that into you and say, hey, this is what I've been thinking about. How can we tweak this? What recommendations might you have for me to make this even better? Are there things I should think about in terms of, the intensity of physical activity? If I'm going to be doing some sort of recreational activity, are there any limitations that you can think of for me? Are there ways that I can do it so I can optimize my therapeutic effects, et cetera, et cetera? So it's an opportunity really for you to have that quick conversation about how to make it even better if they show up to your office with this. Nevertheless, it's here for you to start from scratch too, right? And so it's about asking the right questions, not dictating what you think they should do. So with place, where do you feel safe and comfortable, right? This is a question you can ask, and they give you answers to that, right? So you can tell, there's a comma there and it says outside, right? Because we're really encouraging that. Now, in Texas right now, where I grew up, it's 107 degrees Fahrenheit. So it's not really easy to be outside. So thinking sort of, flexibly here, like outside may not always work. There are some indoor settings where nature is abundant. Your patients may even have indoor plants. You can see one behind me here. So pictures of nature, sunlight. I mean, you got to be creative sometimes when the weather, as we know, climate change is making opportunities to being outdoors sometimes more challenging. Same with activity, ask a question. What do you like to do outdoors? And be specific, right? So these questions are in there. With whom? Do you like to do it alone? You as a provider can wear your therapeutic hat in there and say, my patient does seem lonelier than usual. She is suffering from depression. Maybe some social time might be a good thing. Maybe going with her pet, maybe going with a neighbor, a friend. So some quick little jibes and questions to get in there and see like what actually they might be willing to do, and where might you try to make a slight adjustments to increase the therapeutic value. Same with frequency, same with duration. It's all in there for you to kind of like think about. I would say in my experience so far, doing research and working with, hundreds of providers, the more specific you can be, usually the better, because it's a commitment. And when your patient feels a sense of, okay, we've talked about this, I've got a plan, a really discrete plan, and it's something I think I can accomplish between this visit and the next. Next slide. If you happen to be lucky and live in a place where the parks in your neighborhood or your city are in our platform, certainly you can still prescribe parks. This is sort of a flashback to a previous rendition of what we used to do, but I didn't want to get rid of it because we all know that parks are a place for us to recreate. Parks are a place, are very, very important public space, right? I mean, it's one of the last public spaces that's still there for us to use, right? And to be in and to find pleasure and to really reap its therapeutic benefits. So parks are important when they're available. That option still exists. Next slide. So that was the prescription piece of it. There's this adjunct reminder piece. This is the second half to it. And it's really just as important because this is how you can send a reminder that's automated to your patient, either through a telephone number to send them a text or through their telephone number or through an email. We find that 99% of patients, clients really prefer to have be texted. And we have, of course, the frequency, how many times they want to receive that. We have defaulted this to every day because we know that is the recommendation for us to move every day when we can. So, and knowing that patients will tell you one thing during the visit, but then the next week, let's say you see them in 3 months, but the next week or the next month, what they've told you isn't relevant anymore. So to give them that flexibility to change it maybe from Monday and Wednesday to maybe Saturday to Sunday. So doing it every day is an opportunity for them to be reminded what they've agreed to do rather than fixing it, on only specific days. And then lastly is the duration, right? And that just is commensurate with the number of weeks or months that's going to be between one visit and the next. So every time you see them, you think, okay, when can you come back and see me to get a blood pressure check or to talk about your mental health, etc. That will be how you set the duration of the reminder. Next slide. For those of you who have electronic health records, which is most of us these days, you can simply tap on the copy button, go back into your EHR and paste it into your treatment plan. That's what people do. If need be, you can still print it. And I usually recommend still printing it because that printed copy looks quite nice. You can write the patient's name in it. It has everything you just typed out, which took you that 1 or 2 minutes. And you can sign it so it looks more like an actual prescription. And I also think it's a good reminder, a physical reminder to your patients as they put it up on their fridge or bedside table or in their bathroom where they brush their teeth, somewhere where they're going to see it every day, to literally remind them every day to fill their prescription and then to, of course, go in and electronically log it. So there's no way for them to log it, except electronically, but it's a really, really useful reminder. I say this because in my research, I've seen the differences between providers who print and those who don't. I've seen the differences between providers who talk about the reminder and do a reminder compared to those who don't. And the likelihood for having success in your patient filling the prescription is quite tied to actually doing it a specific way, which is doing the prescription, doing the reminder, printing the prescription, and handing it to them and reminding them to log their visits. Next slide. I did mention that I might talk about my research a little bit if we have time. I think I might have a couple of minutes. So I'm in the middle right now of a randomized controlled trial. It's an NIH-funded trial for 6 to 16-year-old patients at Unity Healthcare, which is based in Washington, D.C. And the prescription is the intervention. So the nature prescription I've just told you about is the actual intervention. The primary outcome in this particular study is physical activity, MVPA. But we have a number of secondary outcomes, which I have listed there, including stress, cognitive functioning, mood, and nature connectiveness. So we're looking at a law. It's a 5-year study. We are 4 years into it right now. We have another year of data collection to go. We're about to publish 3 baseline papers, and we will probably publish a paper as well on sort of the implementation science of this, which I'm finding more and more not just interesting, but important, because it's great to know that this is here. It's great to know the evidence for this. It's great to know how to do it. But the reality is that less than, probably 0.1% of providers in the world are doing this. So count yourself among the elite now who actually know this. But most people really don't know this. And even when they know it, are not incorporating this on a daily basis. So I'm very, very interested in pursuing the research, continuing research on the implementation science piece. Next slide. We are also PRA, and myself and Dr. Stacy Stryer are involved in some collaborations with other researchers, obviously, because we're not set up to do the research on our own. So the previous study actually is based at Kaiser Permanente, Southern California. Deb Cohen is the PI on that project. I'm a co-PI on the project. The one you see here listed is International Rescue Committee and Child Trends. And I'll be working with Winnie Chan on a multi-site feasibility clinical trial. So, and this is a slightly different setup because rather than having primary care providers issue prescriptions, we're going to have mentors. These are community-based mentors for refugee adolescents from countries of lots of violence, civil unrest, who've just become refugees in the U.S. And it's a feasibility study. So we're really interested to see if we can make this work in a very different work setting. And then the second one you see on there is a very, very small study that is quite different. The nature intervention, the nature prescription is not the intervention. And in fact, it's an outcome. And so in this very small study that we're doing now with some funding from the Mental Insight Foundation, we have a federally qualified health center in Houston, Texas called El Centro. There's 3 different sites and there's 20 providers. We're focused on the providers, actually, because there is some literature now showing that we providers are suffering from a lot of the same things I showed you. Stress, burnout, moral injury, problem drinking, sleep difficulties, alcoholism. The list goes on and on. So we're kind of curious to see with this study now, our hypothesis is that if we provide these providers with some nature in their clinic, right? So photographs of nature, indoor plants, a nature therapy walk, will they themselves change? And our premises is that, you know, perhaps one of the reasons why we're not seeing as many nature prescriptions from providers is that they themselves have nature deficit. They themselves are not getting enough physical activity. They themselves are suffering from chronic depression. They themselves are not exposed in their workday, sometimes 8 to 10 to 12 hours with no sunlight, no fresh air, and almost no food. So we're really curious to see if they themselves change. And one of several things that we're looking at is, does their prescribing behavior change before and after? So it's not a randomized trial, it's just a pre and post intervention. The intervention in this case is nature. Next slide. This is the protocol paper we published if you wanted to see more details about the study. Next slide. And this is me a couple of years ago with the first sprinkling of snow in Canada. Next slide. And I mentioned we became a nonprofit in 2017. This is PRA I'm talking about. Our platform in its more or less modern rendition really was launched in January 2019. So we've got nearly 1,700 providers. We've got lots of parks in there, but obviously you don't need a park to prescribe nature, and thousands of prescriptions. Next slide. This is our growth, thanks to you all of providers and using our platform. Next slide. And that's it. So I'm trying to finishing at your time, 12:33, I think. Feel free to, if you need to write me, there's my email that was listed on the previous slide. So if you have any questions there's our website as well. And I think with that, I shall end my slides.
Thank you, Dr. Zarr. That was really great. And Hongyan, if you can put Dr. Zarr's contact information into the chat, that would be great so that everyone can see that. Let's open it up for questions. What questions do we have for Dr. Zarr?
I actually have a handful, if people don't mind. So this is just me. Can you say you have like participating parks? Does this mean that if I do a park prescription, like specifically to a park, I know it doesn't have to be the parks and we can do this anywhere, but if it is to one of your involved parks, does that mean that like the cost of entry is like covered by insurance or it's waived or anything like that? No, they still have to pay to get in.
Well, if there's an entrance fee, yes, and it's a great question. I've fortunately I have heard this many times, and yes, it would be amazing, right? If insurance companies, and there's been lots of conversations with insurance companies to cover this. I think part of it is that insurance companies also need to see the evidence, right? I mean, they need to see that an actual prescription is going to lower blood pressure or lower their costs, right? They want a reduction in their medical cost ratio. So we know that, and I'm working on it as fast as I can, but in the meantime, until there is more robust evidence in terms of randomized clinical trials, we have what we have. Now, I can tell you, like, I don't think we really need these RCTs. This is pretty obvious stuff. But right, I mean, like, really, there's probably no way out of this. I think we're going to have to do this. And I've been saying to providers, thousands of times, look, be part of the solution. Look, if you want to be part of a study, give me a call. I mean, like, we can do it, right? And we're doing it now. So, right, if you want to be part of creating this data and analyzing, and we can help find people if you don't want to analyze data, but we're always looking for participating providers to be part of studies so that we can generate more and more data about this. But yeah, we're still in our infancy in terms of generating that kind of data. However, like, when you look at the big picture, right, we know nature is good. We know being outside is good. We know that there's a lot of studies out there that have shown that physical activity goes way up and mental health improves by spending time in outdoor settings, which include parks. So, you can make an argument now, but yes, we need more data.
Okay. Well, thank you for fighting the good fight on that side. Thank you. My other question is, this maybe if this isn't specifically in your studies, but maybe from your own personal experience, what have you seen for people with intellectual disabilities, autism, and these kinds of prescriptions?
Yeah, so I don't have any specific study data on kids with autism or developmental disabilities or ADHD even. There are some interesting studies out there. I mean, some of the earlier studies did look at kids with ADHD, and they were randomized either to free play, unstructured play, or not, or just the medication alone. And the kids actually who had the unstructured play did as well, if not better, in their system checklist. So there are some smaller studies that have looked at this. Anecdotally, what I see from my patients in the past and from my colleagues who do this, it has been interesting, right? I mean, I do think that, and this comes from my forest therapy, background as well now, but there's something very calming and centering about being outdoors. And I think sometimes that the effect of that is even more pronounced in kids or people who suffer from autism and attention deficit, et cetera. So I think actually there needs to be more research, but just anecdotally, for me, it's usually a red flag. Like, maybe I should talk about that with them. A lot of what I see in a kid's life with those kinds of diagnoses is immense amount of time indoors, and especially with a lot of the technology. So I think it's well overdue for us to be thinking about the nature and its effects on that specific population.
I agree, and thank you so much.
We have a few questions in the chat. So we've only got about 3 or 4 minutes left, but first one is from Brad, who said, I think people intuitively know that they usually feel better when they spend time in nature. What are the biggest barriers to compliance if they know it will help, and how to overcome those barriers?
That's a heavy question. It's one that I've been writing about for the last few days, actually, for an article, for an essay in Pew Charitable Trust, their Trends magazine. I mean, probably the quickest way to answer this is that we don't live in a vacuum, right? As individuals, yes, we have some personal individual will, but the truth is that social and physical determinants of health play a huge role in who we are and our health, and what we're able and eventually, ultimately able to have success with, right? So there's a lot of variables that go into, whether this happens or not. clearly, like, it can't all be, all of the responsibility cannot be placed on this 15 or 20 or 30-minute visit you have, with your client, right? I mean, that's not reasonable expectation. As soon as they leave the office, then they go back into their world. So knowing that, I mean, I would say for now, like, being aware of two things. One, the sort of the stages of change, right? I mean, where are they in their readiness to make this change? All of you probably know about, stages of change, pre-contemplative, contemplative, planning, that kind of. So where are they in their readiness to actually make this change? Which is why I've sort of predicated the prescription based on these questions to ask of them, right? And to initiate a conversation rather than saying, I think you need to go to this particular park and play volleyball, right? So it's really meant to generate a quick conversation, which can then dictate what's going to go into that prescription itself. So that it's very helpful. But then to keep in mind, once again, where they live, how many jobs do they have, other stresses in their life? Are their finances a mess? Are they living in poverty? Like, what else is going on in their life that can very, very much predict success or failure with that prescription? And then I guess just patience with it, try it, I mean, it's a new technology for you if you've never tried it before. So you have to try it and see what it's like. And I have found over the years that like any other technology I use, I adjust it, to suit my needs.
Thank you, Dr. Zarr. I do want to, Michelle, I know you came off of mute, Michelle Barth, sorry. And I didn't know if you had a question before we move to our patient case. Okay, I guess not. So we will do one last question then, and then we'll move right over to you, Michaela. So Laura said, as a recreational therapist, a lot of us work in inpatient settings. As your research progresses, do you see more recreational therapists being hired in outpatient settings?
God, I hope so. There's actually, it's funny you mentioned that. So I only now working in a hospital setting in the ER. This is not what I did for 20 years. I have since been in contact with another pediatrician, actually based in Canada, who's an intensivist, but who is starting an inpatient nature prescription launch there. So, I don't know where this is going to head. One thing I am very interested in, though, is for hospitals to start to pick up on the value of this for themselves and for their patients and staff, right? So in particular, I would love to see more hospitals embrace the sort of biophilic design, which creates opportunities for certainly inpatient recreational therapists, physical therapists, occupational therapists, for the physicians themselves, nurses, etc., in hospital settings to be able to make referrals like that to within their hospital for patients that are inpatient. But I would absolutely love for this to make its way more into the outpatient world. Absolutely.
Awesome. Dr. Zarr, thank you so much for coming in today and giving this presentation to us. Like I said, this was a highly suggested session, so I'm really happy that we were able to put this on for our providers in Idaho. So thank you again.